Hey YouTube, this is T coming at you. So I had a heart cath put in on Friday. Today is October 4th. I had it done on 29th. So what they say is I have an 80% blockage and they need to put a stent in my heart. Y'all, it was so scary. My bed was next to the wall where I could hear everything that was going on in the procedure room. So when the lady was in there and they had to resuscitate her, I could hear the whole thing. So I was in there upset. I was tripping. They called themselves trying to give me a sedative to calm my nerves. Y'all, why the sedative make me start projectile vomiting? Yeah, projectile. It was an experience. It was. It was an experience that I don't wish that on nobody. It was very scary. So now I have to have a stent put in. The stent's going to go in on the 20th, which is 2 days before my birthday. 2 days before my 59th birthday, I'm going to have a stent put in my heart. Y'all, what is this life coming to? I feel like God is testing me. Like he's trying to teach me a lesson. And I feel like I'm not learning whatever it is he's trying to teach me. Because December last year, 3 days before Christmas, I was diagnosed stage 4 metastasized breast cancer. Then in February, I had a port put in, and that next month, the port came out. Literally, I coughed so hard, I made it come literally out of my chest. By the time they was taking it out, you could see that it was purple. You could see the shape of it because half of it was hanging out of me.
You've got mail.
Then I had to get, um, after that, I had blood clots in my chest, throughout my whole chest, y'all. So that was affecting my breathing, which is why I was on oxygen. But one of the reasons I was on oxygen, and one of the reasons they want me to stay on oxygen, was because of that crap. Um, so I had to wait a month and a half. Once the month and a half came, they re-put the catheter in. I mean, not the catheter, the port. So now it's on my left side. Um, and it's just, then come May this year, I had sepsis. If y'all don't know about sepsis, sepsis can kill you. Literally, it can kill you. It is an infection that you get from having an open wound or open sore that gets infected. So sepsis is before you get gangrene. So it has an odor. Um, it's very sore to the touch. It's very warm to the touch because it's infected. So I almost died then. Then in September this year, I had a heart attack and didn't know I had a heart attack. And I'm still amazed that I had a heart attack and I didn't know I had a heart attack. Oh, if you guys are wondering, this is a wig I got from Temu. Um, I got it for like $6. Um, it's a short pixie cut. It comes in blonde, I think a number 27, and it comes in black, which I think is a 1B, and then it comes in this color. Right now it's like $6 on Temu. Um, but y'all, this year has been emotional to say the least. It has been very emotional for me. So I thought I would, give me a second, let me fix this so I can not have to hold it. Okay. I made some notes. So a heart catheterization, in case no one knows what that is, because I didn't know what that was. My mom had it twice, but I just knew they put a tube or something in her groin and pushed it up to her heart, and it was like a camera or something, and they could see her heart and put some kind of dye in it to make sure her heart was doing what it's supposed to do. So the risk is less than 1% of you dying. The mortality rate is 0.05% for digestive procedures, no, diagnostic procedures. Um, why? Why do you have to have this? Well, I'm about to tell you. So it's like the doctor takes, hold on, I wrote this in cursive, I should have wrote this in pencil. Takes a clear look at your heart to identify problems and perform other tests or other procedures to make sure that your heart is beating the way it's supposed to beat, making sure that your heart doesn't need any help, or something like that, or they have to put in a stent or a couple of stents. Recovery time is 2 to 3 days, which I would say that, because when I first got out, I felt really tired from the anesthetic, because they gave me something that made me calm, but even though made me throw up, I still kept the majority of it in me. And the area where the catheter was, you can't, for 24 to 48 hours, get it wet. And then the doctor tells you you can take a shower, but to try not to get that wet. I don't know how you can get your cooter wet, but to take in a shower, but you're supposed to not get your cooter wet. How are you supposed to do that? I don't know. Um, and they call it a non-surgical procedure, despite the fact that they have to numb you, despite the fact that they give you a general anesthetic. I'm sorry, not anesthetic, anesthesia. A general anesthesia um, is supposed to calm you, but it makes you kind of like nod, and then you will wake up. Then you nod. Then you wake up, and you just kind of nod. Like if someone says your name, you can be coherent enough to understand what they're saying to you, but still nod off. At least that's how it does me. Um, the procedure that allows a doctor to diagnose and treat diseases of the heart, muscle, valves, or coronary arteries. So now on the 20th of October, I got to have a stent put in because I have 80% blockage. And the doctor told me that the reason that I have the blockage is because it is hereditary, at least for me. Because my dad died of a massive heart attack. My mom's had 2 strokes. My mom's father died of a massive stroke. Um, my mom's mom died of, she was having dialysis, and dialysis made her, I think, her heart stop or something like that. But it had something to do with her heart because she was on dialysis. Um, and then my dad's mom died of natural causes. She was 102, and they said she died while yelling at some kids. She had a beer in one hand, a cigarette in her mouth, a joint behind her ear, and she died sitting down yelling at some kids to stop making noise, stop playing, stop hitting, or something. That was her deal. They said she just closed her eyes. So I'm really nervous, but I know that it's going to be okay. Because it is. I pray. And I don't just pray because I'm sick. I pray to, just make it. I pray to um, that my children are okay. I pray that my godchild is okay. Well, all my godchildren. Because I have 2 goddaughters and 4 godsons. So I always pray that they're okay, that they're making it. Then I have nieces and nephews that I pray, make sure that they're okay, make sure that their lives are okay. And I'm about to be a great auntie. I often say a great great, but I'm not a great great. I'm just a great. Yeah, I'm a great. Is about to have a baby, so I'm excited. Somebody else to love, a new life in this world to, um, you know, show that life is important. But this is going to be a short video because I don't really have much to say. And I still kind of feel a little aggravated, a little nervous. Uh, my anxiety is kind of high because, I've had some conversations with the doctors and they're saying that it's hereditary. And because I made it to 50, I will have made it to 59, which is my birthday's on the 22nd. I'll be 59. Um, my dad died at age 56 of a massive coronary heart attack. Um, my grandparents were in their 70s. My mom's parents were in their 70s when they died. My dad's mom lived a little longer because my dad's mom my dad was 19 years older than my mom. So his parents were older than my mom. But she managed to have a very long life, my grandma Katie. So for me, I'm just praying that I make it to the end of the year with no other traumas, no other worries, no other causes, no other anything. I just make it and just be okay. I'm still going on my trip in November. Yes, I am. We've changed. We're not going to the zoo safari. We're now going to Universal Studios to just have some fun. I've never been. So I'm going to go do that. That's going to be my birthday present to me. Go and see my son, who lives in Phoenix because he's going to med school. Well, he's going to meet us in LA. So, his birthday's the 19th of October. So, going to have a chance to spend some time with him and his girlfriend and, live life. Be good. So, be good. Be good to others. But definitely be good to you. See you later.